Breast cancer is the second most common cancer in women. That's why it's very important as a lady to know about breast cancer. The symptoms of breast cancer are not usually present from the beginning. It's usually asymptomatic. That's why it's advisable for you to do regular screening of your breast, so that whenever you see any mass or any sign of breast cancer, you quickly run to the doctor. The main hormone that is responsible for breast cancer is called estrogen. Estrogen is abundant in females. So we group the causes of breast cancer into 1. Increased estrogen levels in your body. 2. Intake of estrogen. 3. Lifestyle. And then 4. Family factors. Now when it comes to increased estrogen levels in your body, some of the causes are 1. When you have early first menstruation, it's called menarche. 2. When you don't give birth at all, it's called nulliparity. 3. When you give birth after 35 years old. Or 4. When you are obese. Also, when it comes to intake of estrogen, we have 1. Hormone replacement therapy. Usually after menopause, females experience symptoms such as hot flashes, vaginal dryness, bone pain, joint pains and all. So they are put on estrogen to reduce these symptoms. Also, when you're taking hormonal contraceptives, especially those that contain estrogen. When it comes to lifestyle, 1. When you smoke a lot. 2. When you take alcohol. 3. When you're taking low fiber diets and high fat diets, you are at high rates of getting breast cancer. When it comes to family history, when you have a first degree relative who has breast cancer, I mean when either your mother or your sister has breast cancer, you are at high rates of getting breast cancer. What are some of the signs and symptoms of breast cancer? It's usually asymptomatic. By the time you realize some of the symptoms, it has already advanced. So these are some of the symptoms that you have to look out for in breast cancer. First of all, breast changes. The nipple might be inverted. You might have discharges, usually bloody discharges from the nipple. Also, you might feel a lump in your breast. With breast cancer lumps, it's usually non-tender. I mean, it's not painful. It has ill-defined margins and is usually firm in consistency. When you find these things, please run to your doctor. The treatment option for breast cancer depends on the stage. You can do surgical excision, you can add chemotherapy, you can do radiotherapy. So breast cancer is not a death sentence. You have to identify it early. What are the complications of breast cancer? If you don't identify it early, the breast cancer can spread to other systems. It can spread to the lungs, can spread to the bones, can spread to other systems, and then at the end of the day, it might not be treatable. You might lose your life. So early screening is key to diagnose breast cancer. Please screen your breast. This is Dr. Shades. Welcome to Med Series.